Good morning. My name is Tess Thorman. I'm a research associate at the Public Policy Institute of California. Welcome to our virtual program today featuring the findings from PPIC's latest report, Learning from CalFresh Pandemic Boosts. The report, technical appendices, policy brief, and slides from today's briefing can be found on the website at ppic.org. This research and today's event are supported with funding from the PPIC Corporate Circle and the PPIC Donor Circle. We'd like to thank them for their support. For today's program, I will present some of the key findings from the report and then answer questions from our virtual audience. If you have a question, please send it along with your name and organization to the email address on the screen, ppiceventquestions@gmail.com. As a reminder, PPIC is a public charity and does not take or support positions on any ballot measure or legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. And now, on to the presentation. So this report that I am going to be discussing today is collaborative work with Patty Malagon and Caroline Danielson. I'd also like to thank the California Department of Social Services for their partnership as a data provider and acknowledge that the findings and conclusions that I'll present today are those of the authors. They do not necessarily represent the views or opinions of the Department of Social Services or the California Health and Human Services Agency. For those who are not familiar with CalFresh, CalFresh is the state's implementation of the federal Supplemental Nutrition Assistance Program, which provides cash-like food assistance to low-income families. It's also the safety net program that in California reduces poverty by the most, according to the California Poverty Measure. It's frequently expanded during recessions because it can target assistance to low-income families and local economies. And this is precisely what happened at the start of the COVID-19 pandemic. So federal legislation in March 2020, the Families First Coronavirus Response Act, allowed for boosts in SNAP benefits known as emergency allotments. These ended up being the largest pandemic-era boosts to CalFresh. Looking back at pandemic changes to CalFresh is an opportunity to learn about the program, both in terms of planning for future economic downturns and thinking about nearer-term policy. So to that end, what we do in this report is look at who saw major changes as a result of emergency allotments, how resources shifted for households participating in CalFresh, and then because emergency allotments were introduced suddenly and changed the design of CalFresh benefits, as I'll discuss in a few minutes, we're also able to explore whether these boosts impacted participation, whether they impacted the brief exits and reentries known as churn, and whether they impacted decisions about work. To do this, we leverage administrative records that are housed at the California Department of Social Services, primarily based around monthly records of CalFresh, but also of other programs. So we look at participation in CalFresh, in CalWorks, which provides cash assistance to low-income families with young children, and in SSI-SSP, Supplemental Security Income, which provides cash assistance to low-income, primarily older adults and people living with disabilities. And then we also look at benefit amounts from CalFresh and CalWorks. And we bring in unemployment insurance benefits, as well as earnings from jobs covered by UI, which is the vast majority of jobs in California. So this is the kind of suite of income sources and program participation that we look at in this report. Turning now to the focus of the paper, emergency allotments were authorized by the Families First Coronavirus Response Act in March 2020. And initially what the policy did was give all enrolled households in CalFresh the maximum benefit for their household size. So typically benefits vary both by household size and by income. The most common household size in CalFresh in California is one person. So to put it in context of that size, at the start of the pandemic, a family could receive up to, a one-person household could receive up to $194 a month from CalFresh, depending on their income, and a larger household could receive up to a larger amount. Emergency allotments move everybody to that maximum amount. The kind of immediate effect of this is that the average CalFresh benefit grew 43% between February and March 2020. I just want to underscore 2 points about what this change meant. One of which is that benefits no longer increased or decreased as income changed. As long as households remained income eligible, they would continue to receive a single flat amount. And this is the sudden change in benefit design that lets us look at changes in participation later. The other piece that's really important here is that many households benefited by seeing their CalFresh increase to the maximum amount. Other households already were eligible for the maximum amount, and in March 2020 saw no change from emergency allotments. And this was called out immediately in lawsuits that argued that the underlying legislation actually allowed for increases beyond the maximum, and that those households already eligible for maximum benefits should have seen an increase from emergency allotments. So in April 2021, the federal government revised the design of emergency allotments, kind of reflecting that view, so that starting with April 2021, all enrolled households were guaranteed to receive at least $95 beyond the benefit they were eligible for. So if you were eligible for maximum benefits, you would see a $95 emergency allotment, as opposed to seeing no emergency allotment. The result of that is that between March and April 2021, average benefits increased 11% in CalFresh. It's a much smaller increase than the March 2020 initial rollout of emergency allotments, but as we kind of point out later, it ends up reaching a similar share of the caseload. So about 60% of households enrolled saw an increase in March 2020, and about a similar percent saw an increase in April 2021. I will just put this in context of the fact that there were a number of changes to CalFresh during the pandemic. Here we'll just focus on the benefit changes, but as you can see, there are points where the program was expanded in ways that impacted potentially eligibility or other options. So in March 2020, we see that first rollout of emergency allotments. In January 2021, the federal government increased benefits across the board temporarily by 15%. In April 2021, we see the revision of emergency allotments, that smaller $95. And then in October, the temporary expansion from January ended. And at the same time, we had an annual inflation adjustment and a permanent change in benefits to account for kind of long-term changes in food costs and dietary guidelines that had been planned before the pandemic and happened to coincide with the end of that 15% expansion. So here's what that looks like in terms of CalFresh benefits changing across the course of the pandemic. The big picture is that they increased dramatically. That yellow line in the middle shows us that from prior to the pandemic, July 2019 to September 2022, average household benefits increased 105%. However, inflation was particularly high in 2021 and 2022. So the purple line on the bottom shows us that once we account for inflation, average household benefits in CalFresh actually increased 77%. And the two dotted lines on this chart will show you where emergency allotments rolled out in March 2020, where they were revised in April 2021. The other kind of jump points on here are the ones that we just discussed of points where benefits were expanded during the pandemic. So CalFresh benefits changed during the pandemic, but so too did the kind of typical suite of income sources that households have on hand each month. And that is really consistent with what we know were dramatic effects on employment of emergency shutdowns, of health concerns from COVID, the collapse of caregiving arrangements. In particular, what you can see on this chart, which shows us the share of CalFresh households that had income from each of these sources, is that unemployment insurance played a much larger role once that program was expanded. So prior to the pandemic, about 2% of CalFresh households had any income from UI. At its peak in December 2020, about 27% of CalFresh households had some income from UI. And that really reflects how UI was expanded at several points in different ways. So in terms of the amount of benefits, the duration that people could receive benefits for, and the types of jobs that could make you eligible for UI. We do spend, we go into greater detail in the report on some of the other lines on this chart, but I'll just point out the top line here, the gray line, shows us the share of households that appear to have no income outside of CalFresh. And you'll notice how that decreases once UI was expanded. Now, this chart is showing us whether households had any income from these sources. It looks at all enrolled households rather than following a select group of households over time, potentially while they're not enrolled. In order to better understand emergency allotments, we need to zoom in on just the households that were enrolled when allotments rolled out and just the households that were enrolled when they changed. So the gray wedge of this pie chart shows us the 39% of households who had maximum benefits already in February 2020. These are households that would not have seen a boost from emergency allotments when they rolled out. The orange segment would have seen a boost, and it would have been large because these are households that had less than 20% of the maximum benefits that they could get. So in terms of a one-person household, these are folks who had less than $39 a month from CalFresh and then saw those benefits rise to $194 a month. The blue segment would have also seen a boost, but it would have been smaller. So these are households that had more than $39 a month from CalFresh, but less than $194 before the pandemic. Overall, benefits increased by 85% at the median for households that saw the increase in 2020. And just for context, they increased 40% at the median for those that saw the increase in 2021. So zooming in shows us more about what those groups look like. And specifically, we already know that the March 2020 boost targeted higher earners since it was unavailable to households earning so little that they already qualified for maximum benefits. We can see here, on the right-hand side, that households across the board, whether they received a boost or not, were working at similar levels, even those who had incomes that were so low that they qualified for high benefits. We can now also see, if we look at the first two sets of columns, that those households that had a benefit increase in March 2020 were more likely than those without the benefit increase to have some safety net income. And that's, for example, in the left-hand chart, we can see that 9% of households with no boost had some SSI, SSP income, compared to about 30% of households that had either a small or a large benefit increase. Finally, turning to questions of whether emergency allotments impacted some perennial areas of interest in CalFresh, we find that those who saw the first boost were more likely to remain on CalFresh while eligible and return quickly if they missed documenting their eligibility in time, relative to those who didn't see the boost. So 8 to 15 months after that first boost, we see 14 to 18% higher participation relative to average for those who received a boost. We don't see the same pattern for those who saw a boost in April 2021. So households essentially with fewer resources did not respond strongly to having the incentive of increased benefits. And that kind of suggests that things like administrative burden or other external factors maybe play a larger role for those particularly low-income families in determining, whether they're able to complete the steps to keep benefits. And then finally, national research indicates that SNAP benefits likely have no impact on earnings and employment. What we find here is consistent with that emergency allotment boosts had likely no impact on earnings or employment. So to wrap up, we find here that the initial design of emergency allotments bypassed households that already qualified for maximum benefits. Future responses in economic downturns could be more inclusive and more equitable, for example, by rolling out benefit increases to all households at the same time, potentially by a set percentage, or by focusing increases in benefits on the lowest income households. These are largely federal solutions. However, California does have policy action that it can take, both by maximizing federal dollars and by taking targeted actions at the state level. And both of those approaches is available to the state as it considers how to address one issue that we identify in this report of households with safety net income tending to have lower CalFresh benefits despite having particularly low incomes. So for example, California could potentially draw down federal dollars by ensuring that households are deducting all of their eligible expenses so that they receive their full CalFresh benefits. The state could seek waivers of federal requirements, or in terms of targeted investments, could focus on boosting cash benefits for safety net income households. Overall, policymakers should take the opportunity of looking back at emergency allotments to consider how state policy can work with or supplement federal policy to ensure that CalFresh is achieving the program's core goals. I'm going to switch over to questions now, but at this time, I want to remind everyone that you can submit your questions to PPIC-eventquestions@gmail.com. When you do so, please include your name and organization. And I will stop sharing my screen so that we can transition to those questions. Okay, so my first question comes from California Association of Food Banks. The report focuses on the pandemic, but we know other research shows long-term benefits of CalFresh and the health impact of hunger. As the report notes, the primary purpose of CalFresh is to prevent hunger, and USDA's recent food insecurity data seem to validate that California's continuation of EAs was critical to California having lower than national levels of food insecurity. Can you please share how the report addressed the emergency allotments impact on food security and any long-term evidence? Yeah, so one of the real, I will say, yes, other research has totally validated that food insufficiency in particular fell during the pandemic. And one of the real benefits of using administrative data to look at CalFresh is the level of detail that we're able to get. However, we don't gather through those data in an understanding of how families experienced it and levels of food insecurity. Instead, we can look more at income levels from the data sources that we have. So we see, for example, that CalFresh makes up a really large percentage of resources for many households on CalFresh. That reflects the fact that we're not able to see potentially all of the resources that they rely on each month. As I pointed out early on, there's a large share of households that appear to have no income from anything but CalFresh. And that's, for those households, CalFresh is a really critical resource. There is also a share of those households that are probably bringing in income each month that we're not able to observe. We don't see things like child support. We aren't able to look at stimulus payments, any of the jobs that are not usually eligible for unemployment insurance, which we saw during the pandemic, that there's probably 10% of households that are bringing in income from work, but we're just not able to observe it. So I think that there are two pieces to this, and one is that we know how important CalFresh is, and especially with emergency allotments in the resources that families have, we're not able to evaluate what impact that has on food security just because of the type of data that we are able to look at here. But we also know that there is a bigger picture and a more complex picture of how households are meeting their basic needs. Let's see. My next question here is from Grace and Child Poverty in California. This person asks, the report mentions some factors like sector-specific findings and the COVID spike in enrollment, but spring 2021 was a dynamic period with many issues affecting low-income communities of color, most likely to be accessing CalFresh benefits. To what extent did the report assess these or other contextual factors that affected the association between CalFresh and work outcomes? Yeah, I think this is a really important point. So our research is not causal, so we're not able to say exactly how CalFresh, what role CalFresh would have played in work decisions. I think that the conclusion that we draw from this is that there were so many external factors, particularly because of COVID in spring 2021, that it's important to keep those as the primary things that were likely driving decisions about employment. I would also point out that we, as I mentioned before, we don't have information on stimulus payments. There are so many other pieces at play here. I think it's totally right to focus on the contextual realities of how COVID dramatically impacted employment, throughout the period of this study. All right, my next question is from CalFresh and Nutrition Branch Chief, California Department of Social Services. Were there any impacts observed for households that did not receive the initial emergency allotment in March 2020, but did receive the $95 emergency allotment beginning in April 2021? This is a great question that we kind of made a research choice about which cohorts to focus on and ultimately didn't follow up on this group. But I will say that we did see that a number of households in CalFresh at the start of the pandemic continued through for an extended period of time. So most households throughout 2020 who were enrolled in CalFresh had been on at the start of the pandemic. So it's certainly worth following up on, and I don't have anything to add on it at the moment, but would be happy to look a little bit further into it. My next question here is from a researcher in Berkeley. Did you find demographic differences in when households received emergency allotments, or were people in all demographic groups equally likely to see extra CalFresh benefits during the pandemic? Yes, this is a great question. We did look to see if there were demographic differences, like at the systematic level. And while we do see that there are differences, they're not systematic. So they disappear once we account for how those things are related to income and to household size. So for example, older adults and white and Asian households were overrepresented among those who saw large boosts in March 2020. I think it was just over a third of households with large allotments in March 2020 were exclusively older adults, and like 7% of those who had no boost were just older adults. But that's really consistent with what we know about SSI, SSP recipients, since that program is geared towards older adults. And then it was kind of reversed essentially in terms of age for 2021. And there were fewer race ethnic differences in that one at that point. My next question is from San Francisco. This person says, do you think there might be a threshold at which earnings and employment benefits might be detectable? The median percent increase people received in 2021 was much smaller than in 2020. Do you think if it were bigger, that earnings and employment impacts might have emerged? We did look into this, and I think the answer is no, because we did try this in terms of, did you receive a small boost or a large boost, or on what scale was the boost that you received? And we saw consistent effects between those two things, just kind of chose to present it in the way that we did. But it's a good point to follow up on. My next question is from Sacramento. The report talks about emergency allotments for households that were already on CalFresh at the beginning of COVID, but it points out that CalFresh enrollment increased during the pandemic. Did the emergency allotments actually encourage people to enroll? If so, were most families that benefited already on or new to CalFresh? Yeah, I've gotten this question a couple of times, and unfortunately, we're not able in this report to look at whether emergency allotments had any impact on households that were not already connected to CalFresh. So I can't say from this report whether emergency allotments encourage people to enroll. I think I brought up a little bit earlier that we did some kind of follow-up research afterwards and see that most households throughout 2020 who are enrolled in CalFresh had already been participating at the start of the pandemic. So to that end, emergency allotments were primarily impacting households that were already low income and already connected to the program. It is true, enrollment was around 2 million households at the start of the pandemic, and it rose to about 3 million by fall 2022, which is the end of this period that we looked at in the study. There's kind of two ways to look at enrollment increases, and one of them is that fewer households are exiting the program. The other is that more households are entering, and potentially there's maybe even a third that households are returning to the program. One way that this happened during the pandemic is that initially the federal government paused redetermination. So households, this is typically a place that many households exit the program, between households that needed to report on their incomes in March, April, and May of 2020 had an extra 6 months to do that. And so we see at the same time that there was an increase in the caseload and the number of households enrolled in CalFresh between February and June 2020. Part of that is many new applications and many new households entering the program, and part of that is households staying in the program. So I think there's a big picture about whether emergency allotments did or didn't encourage households to enter, but it also was a period of time when probably regardless of the incentive of increased benefits, many households were becoming eligible for the program and would have been drawn to it regardless of the benefit increase. But we're not able to shed light on that particular piece with this report. My next question is from Chico, and this person asks, I'm curious about households that seem to rely only on CalFresh. because it seems like a really high number. What does that mean? And could it be they just have income that's not in your data? Yeah, I started talking about this a little bit before. We don't see income from self-employment or from gig work, things that are not covered, jobs that are not covered by UI. We don't see child support, Social Security, disability. Tax credits are a really important source of resources that we don't see here. We aren't able to connect pandemic EBT during this period. So I think there is the whole world of income sources that we don't observe, that when we see about 40% of households that include some adults, so we might expect to see their income, not having resources outside CalFresh. Some of it is surely about they have monthly income or they have monthly resources from one of these other sources that we just aren't able to capture. But the other piece is that some people truly are in that month without income, relying on savings, taking on debt, going to friends, families, charities, relying on food banks. CalFresh is a extremely important source of resources for those families, and we don't know exactly what share it is that truly have no other resources versus just have something that we're not able to observe. But it's important to keep in mind as we think about what we know from administrative data about income sources. Okay, my next question here is from LA, and this might be my last question. This person says, can you say more about other changes to CalFresh during the pandemic? Were any of them permanent, or have they all ended at this point? Emergency allotments were kind of the last expansion that ended in March 2023. And I talked a little bit before about the permanent change that happened during the pandemic. That was not a pandemic related change, but the Thrifty Food Plan in fall of 2021 was updated. The Thrifty Food Plan is essentially the way that SNAP benefits are calculated. It typically gets reevaluated, but until 2021, hadn't been allowed to change the benefit amounts nationwide. And so that was the first time in 45 years that benefits could actually increase to reflect contemporary dietary guidelines and food preparation habits. So this was a significant change that maybe was not experienced as large as it actually was. We, without other expansions, we think that the change would have increased benefits by 21%. But as we discussed earlier, benefits had been increased by 15% for much of the year before that. And that expansion ended at the same time that the Thrifty Food Plan change was implemented. So in reality, while with emergency allotments, with that 15% increase phasing out, households actually probably saw benefits increase by $12 to $16 a person. So that change is still ongoing, but there were, quite a number of pandemic era expansions in CalFresh that have phased out with the end of the public health emergency in 2023. I think that we don't have time for any other questions, but we've reached the end of our program. I would like to thank the PPIC Corporate Circle and the PPIC Donor Circle for their support of today's program. And thanks to all of you for joining us online. We would appreciate you taking a moment to give us your feedback on this event. So if you pre-registered for the event, you'll receive an email with a link to a short survey. You can also scan the QR code on your screen right now. And finally, a recording of today's event will be available by tomorrow afternoon on the PPIC website and our YouTube channel, so you can watch it again or share it with your colleagues. Thank you, and have a good afternoon.